Hello everyone, I'm glad to be here again to talk about my another recent paper that published in Journal of Global Psychiatry Archives. My name is Darya. The title of the paper is Observation of Rare Psychosocial and Mental Health Symptoms in ISIS Psychiatric Patients, a pilot study among ISIS affiliates. So for those who don't know what ISIS stands, I stand for the Islamic State of Iraq and Syria. As majority of you know that the ISIS organization have been occupied Iraq and Syria in 2014. Mainly, they occupied the largest part of the Iraq that's located in Nainawa Governorate. This is the map of that's showing the conflicts in Iraq during 2015 and until the end of the ISIS authority in Iraq in 2018. So, what's interesting in this paper, uh, there's a lack of study that have been conducted among the terrorist groups, mainly the ISIS. So this is considered to be the first paper that directly recruited the ISIS affiliates to be the sample of our paper. So in this clinical trial, we had two groups, the intervention group that included the ISIS affiliates and control group, which included the non-ISIS patients. So we had 12 ISIS patients in the intervention group and 9 non-ISIS patients in the 12 group. So we uh, we we created very interesting assessment procedure throughout our research that outlined in this diagram. This is the assessment procedure we use it to assess the mental health and psychosocial symptoms of ISIS psychiatric uh, patients. So this study, the duration of this study was 1 year, 12 months. We observed the ISIS psychiatric patients during this assessment procedure to know any unusual and rare psychosocial symptoms they show. So the result of this study showed that both the intervention group and control group have been diagnosed with MDD and PTSD, but at the same time, the ISIS patients have shown some unusual symptoms that did not exist in the control group and even did not exist uh, in the criteria and symptoms of the psychiatric disorders in DSM-5. So we found 16 unusual symptoms among the ISIS affiliates. This table shows these unusual psychosocial symptoms and possible causes of the symptoms. Here in this column, we have revealed the symptoms, unusual symptoms of ISIS patients, and in the opposite column, we discuss these symptoms, why they have these symptoms and why the others do not have. Everything explained in this table. You can read it and understand it easily. So the result of this study suggested that um, the current study confirmed that and indicated that the ISIS patients suffer from a variety of psychological disorders such as PTSD and MDD, but at the same time they have unusual psychosocial symptoms that include 16 unusual psychosocial symptoms. And based on this finding, we called this phenomena, this unusual finding, we called it ISIS syndrome. So what's the ISIS syndrome? According to the present study, the ISIS syndrome is a psychosocial condition that has certain atypical symptoms in addition to other mental health disorders, including PTSD and MDD. So to conclude that the ISIS psychiatric patients, they have suffered from PTSD and MDD, but at the same time, they have some unusual symptoms that did not exist among other patients that have the same diagnosis. So we suggested that this syndrome might be maybe common among the terrorist organization groups, the members of terrorist organization groups, particularly among the affiliates of ISIS group. So we encourage the future research to conduct more study among the ISIS patients and to confirm this syndrome to be internationally recognized. So thank you very much for listening to this brief explanation for this paper. I hope you found it interesting, and if anyone want to read more about the ISIS syndrome and about this paper, and the link of the paper is attached in the description. Okay, thank you. Bye bye.